Today we're talking about mental health treatment in the United States, or should I say mistreatment. Approximately 1 in 5 adults lives with mental illness in the United States. That's 44.7 million adults. And this is just people who are diagnosed. Think of the uninsured, those who can't afford to see a professional. This includes anxiety, depression, bipolar disorder, substance abuse, personality disorders such as borderline, ADHD, schizophrenia, OCD, PTSD, and a whole nother alphabet that you can't even imagine right now. Of these, depression is the #1 cause of disability worldwide. In particular, I'll be talking about inpatient or extended hospitalization of a person experiencing a severe mental health problem. In 2014, 5 million people presented to the ER with a mental health diagnosis as the primary problem. In 2012, 8.6 million people had inpatient stays related to substance abuse or mental illness. This is 1/3 of all inpatient stays of that year. Let's bring it back to colonial times. So, in the beginning of the United States history, the goal was to keep the mentally ill out of trouble, so they kind of wandered about the countryside. In 1773, the first hospital for the mentally ill was established, the Public Hospital for Persons of Insane and Disordered Minds. Mental illness was synonymous with insanity, and it was pretty broad, treating anything from symptoms of autism to disappointment in love. By 1890, all states had at least one publicly supported mental health hospital. By the mid-1900s, over 500,000 patients were treated, but the treatment wasn't so hot. One of the treatments they used was quote-unquote moral treatment. Yeah, moral. It was kind of like rehab. In the inpatient centers, people were exposed to normal habits, so like working, dressing, and making food. The centers were often connected to farms. Those provided both food and work. Sounds great, right? Well, that didn't work so well because it was paired with torture. Yeah, you heard it right. Solitary confinement, bloodletting, strong drugs, but bad drugs, shackles. And it's great. It's prison. Asylums were super popular during this time, known for the confinement of the severely mentally ill and potentially dangerous patients. Another treatment was eugenics. Yes, euthanasia of people of color, immigrants, poor people, unmarried mothers, and disabled, because they wanted to see if this was linked to mental illness, which we now know is, but for totally different reasons. But that's for another lecture. As we advance into the 20th century, the 1900s brought some new treatments that we still use today. Electroconvulsive therapy, or ECT, induced seizures with electric shocks to curb severely depressed or suicidal patients. And some more experimentation included the famous lobotomies, or, the ice pick, sticking it in the eye and poking through to the prefrontal cortex, which supposedly helped get rid of some severe symptoms. Another man named Henry Cotton thought it was a great idea to remove organs and teeth to cure mental illness. Surprise! It wasn't. The Great Depression rolled in, and these hospitals are, you guessed it, overcrowded. Quality of care is decreasing pretty greatly, with dysentery outbreaks and a guy in Salem, Oregon even killing 42 people by accidentally putting rat poison in some scrambled eggs. Even more quality of care problems led to the creation of NIMH, the lovely website and organization that gave me a whole lot of info during my undergrad and for this project, short for the National Institute of Mental Health, established in 1949. This organization would oversee psychiatrists and encourage community care. This idea of community care was great in theory, but we were in a time where there weren't many evidence-based interventions to back it up. So here comes some more trial and error and experimentation. And so deinstitutionalization begins. In 1955, shortly after NIMH was established, the state outpatient clinics, state governments, and counties began to support mental health less on that level. John F. Kennedy had a sister, Rosemary Kennedy. She was sweet and lovely and had a mental disability. Her family did a lot to keep her happy and prove the experts wrong, like putting her in a Montessori school and letting her take up art. But her condition was getting worse. And When she was in her early 20s, her family arranged a lobotomy for her. And that didn't work out so well either. She was unable to speak or dress herself after the operation, and it kind of tore the family apart. This brought the issue of mental health to the future president's attention, leading him to establish the Community Mental Health Act in 1963. This was a reaction also to the bad conditions in the state hospitals that he'd seen. This act gave $150 million in grants to build CMHCs, or Community Mental Health Centers. So instead of keeping people in hospitals, they stay in these centers. These are kind of utopias that provided inpatient, partial hospitalization, outpatient services. It was kind of like a hub for mental health. And it also had a focus on prevention, which is something we haven't really seen before this time. Unfortunately, he was assassinated a few days after signing this act. Some of these centers were built, but they weren't ever fully funded, so they never had their maximum potential. People were starting to get discharged from state hospitals to go to these CMHCs that didn't even exist yet. Lyndon B. Johnson, JFK's successor, supported this Mental Health Act, intending to ask for, quote, increased funds for research centers, special teacher training, and funding for state and local programs, end quote. By 1970, 270 centers were in operation, but the prevention of mental illnesses, a keystone in this act, was not feasible. Most people were subacute, and not the most sick. The most sick were discharged from the hospitals and didn't have anywhere to go. Plus, courts issued rulings that would facilitate the exit of patients from state mental hospitals, and Medicare and Medicaid encouraged this as well. Richard Nixon, on the other hand, found this to be a communist plot by his presidency. In the beginning of his term, 400,000 mentally ill patients were in state hospitals. At the end of his presidency, in 1976, 170,000 were left. Over half were discharged. 12 state hospitals closed. So basically, the community mental health centers weren't working out in reducing public mental hospital populations. Jimmy Carter understood that. In 1980, he signed the Mental Health Systems Act, which aimed to restructure the community health center program and improve services for those with chronic mental illness. But Reagan wasn't too happy about that. In 1981, he overturned this, and discharges began to occur. Block grants went to states instead of CMHCs. In 1981, almost 433,000 beds in state hospitals had been closed. So in the 80s, those who were discharged mostly ended up in assisted living in bad neighborhoods. In Los Angeles alone, 11,000 were living in the facilities. Hundreds of thousands of beds closed. This was called horribly wrong by critics, and those with mental illness began to become the homeless population. In 1984, an Ohio-based study said that 30% of homeless population had mental illness. Associations with murder and mental illness and crime began to increase as these people were untreated. And the 90s weren't much better either, as more crimes were connected to mental illness. And now we go to the 2000s, or the present day. Dr. Torrey in American Psychosis writes that jails and prisons are the new inpatient, and sheriffs, police, and courts are the new outpatient. The people from the 80s and 90s weren't treated. Those people had kids. They're on the streets or arrested, and it's just a horrible rundown of what Kennedy had imagined as something wonderful. But it's not all bad. We now have the recovery movement. This looks to the patient as a survivor and frames care around the patient, not the illness. Stigma is decreasing as we have movements from organizations like NAMI, the National Alliance on Mental Illness, or Mental Health America, even the Brain and Behavioral Research Foundation that's looking for a cure for mental illnesses. And we have to keep opening the conversation. So I talked to some nurses in SLU Hospital, and they said that resources and education within inpatient units, even a revamped version of the state-run facilities, would help combat this problem of combined homelessness with mental illness. Nurse Leanne even said that they have a disservice done to them as patients and as people. And I think, as a public health major, it is my duty to fix that. Thanks.